Well, with COVID-19 infection rates spiking in many places around the world, some countries are counting on vaccine booster campaigns to provide relief. One of those countries is Indonesia, which launches its booster campaign today. With some 4 million infections and 150,000 deaths, the world's fourth most populated nation has been hit hard by the pandemic. The health ministry has pledged to vaccinate more than 208 million of its 270 million people. DW's Georg Matthes visited one factory in Bandung on the island of Java, ramping up production for the booster drive.
Indonesia's vaccine production in full swing. What you see in these bottles is the Chinese Sinovac vaccine, the #1 immunization available here. Nani Nuraini is in charge of the process. In a factory in Bandung, her team assembles crude components imported from China.
In the pandemic, access to COVID-19 vaccines has been limited. Of course, when buying, we have to rely on external funds. If we had our own jab to supply our people, then it would be affordable. That way, there's more accessibility and a more even distribution of the vaccines in Indonesia.
Since the pandemic broke out, Nuraini has been working around the clock. The state-owned pharmaceutical company is also hoping to develop its very own vaccine. An exciting process for a scientist. But Nuraini says it's also challenging for her as a mother of two, especially if things don't go according to plan.
We have this term called the valley of death in the manufacturing process. Some products here end up just as a prototype and never make it. You have to bear in mind, vaccines will be given to millions, billions of people, so they need to be affordable too. In the end, a key objective is to be cost-effective and efficient.
Female scientists like Nani Nuraini are still a minority in Indonesia, despite the fact that at university, women in this field are the majority. 8 out of 10 undergraduates are women among the students at the medical faculty next door. Analyzing COVID-19 swab tests is a much-needed skill these days. But only 1 out of 3 of these female students will move on to a doctorate degree.
There are still a lot of stereotypes when it comes to professional science. Many feel a professional teacher or a government employee will just make more money. So many women are discouraged from continuing their studies as a scientist.
We need to work on ourselves if we really love science, but the government should also facilitate and support us in this endeavour. There could be more funding, more laboratories and learning opportunities overseas.
Indonesia has so far fully vaccinated more than 40% of its 270 million people. But with the arrival of Omicron, even more vaccines are needed. The country now launched a booster program early in an effort to prevent the next wave.
And joining us now from Jakarta is our Asia-Pacific Bureau Chief, Georg Matthes, who filed that report. Georg, tell us more about Indonesia's booster campaign that's just kicking off.
Sure, Terry. Well, here in this hospital in the heart of Jakarta, people started queuing early in the morning. Everyone who received his second vaccine shot more than 6 months ago now qualifies for a booster. And elderly will be privileged. That was a very clear message from the government. And after some controversy, also the president announced yesterday that the boosters will not only be free of charge for the elderly, but basically for everyone who's interested in a booster. Now, one thing is interesting here in the booster campaign, and that is only half a dose will be administered, not a full dose. And that may have something to do, there's scientific reasons given for that, but it may also have something to do with the fact that the vaccine campaign for the rest of the country is still in full swing.
So Indonesia is hoping to head off the next wave. What's the current COVID-19 situation in Indonesia, Georg?
Well, seeing that Indonesia had a huge peak last year in July, the numbers are still comparatively low. However, we have at the moment 800 cases. It's a 4-month peak in Indonesia. 500 of those are Omicron cases. It's a number doubled basically from yesterday. So the country is preparing for an Omicron wave. What officials here in Indonesia hope is a recent survey has found that actually 85% of the population have what they call here super immunity. So immunity either stemming from vaccinations or from a natural infection. And the hope is that this will at least reduce the number of hospitalizations, because in the second wave that the country faced last year, hospitals were simply overwhelmed.
The Indonesian government, I understand, has imposed widespread travel restrictions. Georg, how effective have they been in protecting the population, particularly against the Omicron variant?
Well, so far one has to say they have been quite effective, because the case numbers are still low. And you have to see there's a number of countries that are now being put on a blacklist, including the UK, France, Denmark, a number of African countries where you can't at all travel to Indonesia. In other cases where case numbers are really high, you have a 2 weeks quarantine that you have to spend in the capital of Jakarta. And the hope really is that this will slow down the arrival of Omicron. Everyone here is well aware that sooner or later, if you look at India, for instance, those Omicron cases will arrive here.
Georg, thank you so much. Our Asia Pacific Bureau Chief Georg Matthes there in Jakarta.